Well, Adam, I'm looking forward to today's guest. We have Bob Keiserman joining us. He's the volunteer founding executive director at the Power of the Patient Project. What do you know about what he's doing?
We don't have a deep relationship with Bob, but we connected with him not long ago. His group approached us about our patient engagement research, and we quickly aligned. They actually had us present to them, and now they're reciprocating and helping us understand what they're doing. The Power of the Patient Project, as I'm sure he'll talk about, one of the only digital libraries in the country devoted exclusively to education and information on patient rights. So they truly are trying to get at the heart of what the patient needs. So obviously that's a strong fit for us, isn't it?
Yeah, it's an interesting approach. Typically we're talking more about the technology with these guests, so it'll be fun to hear what Bob has to say.
Yeah, I agree. Let's jump right in.
We are very happy to welcome Bob Keiserman, Volunteer Executive Director for the Power of the Patient Project. And for those not familiar with the Power of the Patient Project, their mission is to empower patients to be better consumers of the healthcare delivery system. And Bob, welcome to our podcast. We're thrilled to have you join us today.
Thank you. Thank you.
We would love to have you share your background a little bit. Tell us how you got involved in healthcare and how did you get started in the Power of the Patient Project?
I'm a retired professor of healthcare administration and medical ethics. I taught men and women to lead healthcare organizations for over 35 years. I started my career at the Temple University Medical School, where I was teaching medical residents about going into private practice. I then spent 15 years of my career touring the United States, teaching OT, PT, and speech pathologists to go into private practice. It was a different time then. What was happening is that Medicare was under the retrospective payment system, and now they're under the prospective payment system. And under the retrospective payment system, basically hospitals and private practices could charge anything they wanted to charge. So it was a much more entrepreneurial lifestyle for the providers. When that changed, so did my business. And there was less interest in private practice because everyone was going into corporate-owned practices. And that was when we began to see the doctors going to work for the hospital systems and becoming employed. So I remember very clearly for decades, doctors being in private practice, truly owning their businesses. And then I also witnessed the transition, which we're now involved with heavily, where most doctors are employed, which, in my opinion, among other things, has led to the physician burnout that seems to be a huge issue right now, especially the older doctors. The older doctors persevered. They, in many cases, were bought out by the hospital system, so financially they made out okay. But when they stayed on, the hospital systems and the HMOs put a lot of limitations on them, and much of which was, interesting enough, technology. They said that now you have to adhere to certain standards with technology, and a lot of the older doctors said, this is not for me. This is not what I went to medical school for. This is not how I practice medicine. I'm hanging it up. I'm going into either another career or I'm retiring early. So when I retired, I had been working prior to my retirement with a bunch of students, and we had put together an organization called the Power of the Patient Project. One of my areas of expertise and one of my passions is in patient rights and empowerment and advocacy. And I saw firsthand how many patients would come into a doctor's office and be at the whim of the provider. Whatever the doctor said, they did. No questions asked. So we felt it was our role to basically educate patients that there is in fact something called the Patient Bill of Rights, that it has stability, and that patients should be educated in it so that when they go into a doctor's office or into a hospital, they're an educated consumer, that they understand what rights they have, they realize that they have the ability to question a doctor, to come with questions and question a diagnosis. And long story short, the end of the story is that in 2018, we were recognized by the National Library of Medicine, which is part of the National Institutes of Health, as a digital library, and we became the National Library of Patient Rights and Advocacy, which is what we now work on. So our website is set up as a digital library. One of the reasons I did that is because not only am I a professor, but I'm also a medical librarian. I have an MLIS from Rutgers University, and that was my area of expertise and concentration when I was in library school. So we are set up as a digital library. We have over 150 video segments, one of which features Adam, a very good interview. And we have resources. And so it's really a go-to place for patients if they want to understand diagnoses, if they want to understand treatment plans, if they want to understand their options in terms of what they can do as a patient. And that's what we set up. Prior to COVID, we went out and did live presentations to patient support groups. When COVID occurred, we could no longer do that, even virtually, because the patient support groups were just not meeting. So that's, in a nutshell, what the Power of the Patient Project is all about.
That is so interesting, and it certainly aligns to a lot of the energy we're hearing at class about consumerism, and really aligns nicely to the purpose of this podcast. How do we amplify the patient's voice and knowledge and insights that we all need as patients? Bob, I'd love to hear some of the common use cases of ways you help patients. What comes up frequently in the digital library, and how are people using that?
I think one of the major areas right now that we're seeing use of is the mental health area. COVID has certainly done a number on everybody in this country in terms of mental health. And so we have focused a lot of our energy on doing interviews with prominent people, bringing helpful videos into the mental health room. We call our different sections of our digital library rooms. And we've enhanced our mental health room with all kinds of great videos. One of the things that I'd like to mention, which really ties into what you folks are doing, is, and I'm going to be very open and honest, prior to COVID, I was against telehealth, saw it as a dangerous tool available to providers. I often would lecture my students and tell them of all the horror stories that could occur, did not believe in it. COVID changed my mind completely. The fact that we were able to have doctors talk to patients using a computer screen, not only consult with those patients, but actually diagnose patients by actually showing them and examining them, totally changed my mind about telehealth, to the point now that I have spoken with many providers, and they truly believe, even the ones that were not in favor of it, they truly believe this is now going to be part of medicine. It is an option for patients. It is cutting down, I hope, with the overscheduling of offices, where we once were scheduling 3 or 4 patients for every appointment, and people would have to wait long waits in the waiting room. I think telehealth has given patients and providers the ability to have that option of not having to come into the office and rather consulting online. That's another thing that I've seen, and a lot of patients have been very vocal about.
We hear that quite a bit.
There was a change of heart across the whole industry. And, it's interesting, Bob, I was looking at one of the resources on the Power of the Patient website. There was a poster, I think, that you had authored on there that walked through a few of the rights of the patient.
Yes.
And a few of the items on there talked about wanting to be seen in a timely manner, wanting to be not left in a wait room for longer than 15 minutes, not having to wait on the physician. I think telehealth solves many of those challenges if the schedules are managed appropriately.
I agree. One of the greatest problems that I saw in an office was that in many prominent practices where you had even 5, 6, 7 doctors, people had to wait. And sometimes they had to wait a long time. Yet when we got into the doctor's office, the issue was that the doctor spent less than 10 minutes with us. We may have waited 2 hours to see that doctor, and we saw the doctor for less than 10 minutes. Today, one of the biggest complaints, as I'm sure you're aware, is that because of electronic medical records, many doctors are not face-to-face communicating with their patients, even in a live situation. And so a lot of patients are complaining, I'm in the same room with you, but you're not relating to me. You're relating to that machine in front of you. And many providers are frustrated with that as well. And I think that's also becoming an issue with technology. It's a good thing that we have these records. One of the things that I see as a patient is the wonderful opportunity that if I go to any doctor, that doctor is able to see all of my medical records from any other doctor. That was never able to be done because everybody was using paper charts. So today we have universal sharing of the medical records, tests, notes, everything, which helps especially when you go to a specialist. There are smarter patients and there are less smarter patients. And the less smarter patients have real problems with all this stuff, especially the older ones, because they're accustomed to the way it used to be. And the younger patients, on the other hand, they're able to adapt more to this. They feel comfortable with a doctor talking to them on their smartphone. The older patients do not. It's a learning curve, but I do think the older patients, especially because they were the most vulnerable during COVID, they accepted this telehealth thing, and it worked for them. I wrote that poster a couple of years ago, and those are the most important things to me. When I sit in a doctor's office, I want to see how well they process patients.
Bob, are you visiting offices to conduct your research and understanding, or are you just scheduling a lot of appointments? What does that look like?
Interesting that you ask. We have a research division launched within the last couple of months called MedFocus Research. And this summer, I'm working with 15 graduate students who basically have a background in medical sociology. And they are at a point as we speak of sending out 3 different surveys, one in mental health, one in women's health, and one in primary care, to patients throughout the country through social media. And we're waiting for the responses. We also have developed a survey that we're trying to distribute to providers. We want to find out from the patient's perspective and from the provider's perspective what makes a good patient experience. So hopefully with that information, our intention is to share it with the medical societies throughout the country and the physicians. So we're waiting for the results and see how successful we are with our survey, but we feel that this is really an important thing to find out.
That's so interesting and aligns nicely with some of our interest and efforts and focus as well. Bob, we may need you to come back on in a few months and share those findings. I think our listeners would really be interested.
Now, Bob, how might a healthcare delivery organization or a physician practice consider engaging with the Power of the Patient Project to support some of the things that they're doing as they try to educate patients?
Okay, so what we're hoping for and what our marketing is all about is that we just want people, we keep adding resources, and we want people to be attracted to and use it as a go-to for information. That is our sole mission and purpose. We have reached out to providers and to medical societies, letting them know that we exist. I will share a very interesting tidbit real quick. There is an organization that has surfaced within the last 3 months. It is led by actress Susan Sarandon. They call themselves Power to the Patient. We are power of the patient, and they're power to the patient. And their focus is on poor transparency of hospitals with their rates. That's their sole purpose. So people are getting confused with them and us. We're getting a lot of calls. People are asking me all kinds of questions that I can't answer about what about a bad bill. But anyway, in answer to your question, we want people to just visit us, know about us, and feel free to use the information that we have and to watch the videos. We have a lot of videos on all kinds of areas. As I said, mental health, women's health, medical ethics, and we have eating. We've done our homework and tried to interview some of the most prominent people in the field of wellness and healthcare.
This is great, and probably a good time to insert the official name of your website. It's thepowerofthepatient.org, and really a wealth of information here for anyone that's trying to access resources, ideas, see what's happening in the world of improving care for patients, very specifically. Bob, a few more questions here, and this is so helpful and interesting. We thank you again for your insights. What advice would you give healthcare technology vendors on what they could do to be more patient-centric? In your experience and in the efforts of the Power of the Patient, what comes to mind?
Well, again, I think that age is very important in terms of different ages, backgrounds, cultural backgrounds of patients. We tried to study these differences. Certainly the most recent generations embrace technology. The older generation, like myself, we have a learning curve with technology. I would tell the healthcare the vendors for healthcare technology that they need to be focused on enhancing the actual patient experience, making it easier for a person to communicate with their doctor. One of the greatest inventions that I think we've come up with in the past 10 years in terms of the patient experience is the patient portal. This is so invaluable to patients that in between visits, they have the ability to talk to their providers online. And most providers I have found are really good about replying as quickly as they possibly can. Patient portals have become really important, and those practices and those hospital systems that don't embrace that technology, I think, are missing a tremendous tool. I would also tell the vendors that they need to be mindful that it's going to take certain age groups, certain cultures, a little bit more time to embrace technology, and that they have to do a better job at marketing the technology so that it's not only embraced by the provider, but equally embraced by the patient. I think that many vendors focus more of their marketing and public relations on the providers, trying to sell them the technology. But I think they'd be better served perhaps by also not so much more, but certainly equal in terms of their focus on the patient and making them feel comfortable. Teaching a patient how to use the technology in workshops, webinars, and so forth. Giving providers tools so that they can refer patients to websites so that the patients can learn more how to use the technology. I just talked about the patient portal. There are plenty of patients who have access to a patient portal, but they don't know how to use it, or they're afraid to use it. And we have to overcome that fear. We have to make sure that people are comfortable with it and understand its value. So those are some of the things I think that I would share from the patient's perspective that the vendors could be more mindful about.
Super helpful.
You know, Bob, a few minutes ago, you acknowledged that technology is now centric to the way a provider delivers care and the experience that the patient has with the provider as they're in the visit with them. What advice would you give to the providers as they engage with technology, but also seek to be more patient-centric as they deliver care?
Okay, so healthcare has come up with an answer. Not all practices, not all hospitals have embraced it, and that is the medical scribe. The medical scribe is typically a woman or a gentleman who are in medical school, or at least trained, to take notes for the doctor. And the better scenario would be if the doctor is face-to-face with the patient during the examination, constantly speaking face-to-face to the patient, and letting the medical scribe use the computer in the same room and take the notes. To me, that's a solution. What we're trying to avoid is for the doctor to be in front of the computer at the laptop or whatever setup they have and like turning the shoulder once in a while to speak to the patient. Patient wonders, what am I doing here? I could have done this at home. Why am I in an office? The other thing that's happening with technology when they have these medical records and the doctors are so focused on that, it's definitely taking away from examination time. There are many times when cardiologists are not taking out the stethoscope, but they're basing everything on the cardiogram, echocardiogram. And some patients walk out there and say, the woman never listened to my heart. And that's because they're putting a lot of credence into the technology that they have in the visit. And most patients, especially older patients, are accustomed to being examined completely. So I think that's, in answer to your question, the medical scribe could take that doctor away from the screen, and the doctor needs to be very mindful of the fact that the patient expects to be fully examined and spoken to face during the visit.
That's very interesting.
Very important, isn't it? We need those personal interactions. Well, Bob, this has been very enlightening. We haven't done a lot with you and your group, but it's clear that our missions aligned so quickly that we're delighted to have you join us and share your perspective. We were happy to support your efforts. And just a reminder for everyone listening, you can get more information, all kinds of resources on thepowerofthepatient.org. And Bob, it's been a pleasure. Thank you for your leadership and your efforts. We hope to support you and your team for years to come.
Thank you. Thank you very much for having us on. And we look forward to working with you as well. Thank you.
Thank you.
Thanks, Bob.
Well, thanks again to Bob Keiserman for joining us. I was really glad he could participate, and we learned quite a bit from him. Dan, what stood out to you in that interview?
You know, Bob talked a lot about empowering the patient through education, through he talked about his patient bill of rights that he created, and I thought it was really fascinating. Sometimes as a patient, you don't know what you can and should expect from your healthcare provider, and the patient bill of rights does just that. It helps a patient understand what maybe they should be asking for as they come in for a visit, and what some of the basic service expectations they should expect out of those visits. I just think that's really powerful as a patient.
Yeah, I agree. One thing that jumped out at me was the idea we really need to consider the different aspects of a patient's needs. When we asked him what advice would you give, and he talked about the age of the patient or their different culture or background, that's really important. You think how that can apply to technology as well. We often hear in our research that different age demographics have different comfort levels of using technology, and I think that's shrinking. I think the older generation is getting more and more comfortable, and we'll see. But good advice for our vendor partners out there.
Yeah, love it. What a great way to end. We'd like to just thank our colleague Jeff Peterson for helping coordinate the technology around this experience, and we're excited to participate with you again on an upcoming episode.
If you have any ideas of topics or guests that you'd like to see on the podcast, as always, please reach out to our email address, patientengagement@classresearch.com. Until next time, thanks for joining us.